Operatory technique: isolation of the operative field, cleaning the damaged surface with a sterile cotton swab dipped in calcium water. We should avoid using air under pressure. Application of the veneering material on the exposed dentin and at the site of exposure. Placement of a semi-permanent filling material to avoid marginal leakage. And finally, clinical radiographic control. Calcium hydroxide. Calcium hydroxide is a material of choice for its antibacterial activity and its alkaline pH. The calcium ions that form the dentin bridge don't come from calcium hybridage, but from the systemic circulation. Pure calcium hydroxide has the most alkaline pH, but it forms a dead space between the pulp and the barrier that creates a favorable zone for bacterial recolonization, thus preventing the success of the treatment. This dead space is the result of the superficial necrosis that occurs when placing the calcium hydroxide in contact with the exposed pulp, and the response capacity is faster. Actually, setting calcium hydroxide is used since it doesn't produce superficial necrosis, so the pulp reaction is slower and the response more biological. From the citable calcium hydroxides currently on the market, the cal is the one that contains the most alkaline pH. Histopathology. Number 1. At the pulp exposure zone, an area of acute inflammation occurs, while the rest of the tissue is not affected. 2. The underlying vessels on the exposure they dilate. There is edema and accumulation of polymorphonuclear leukocytes at the site. Within a few days, an acute abscess may develop. 3. Healing depends on tissue destruction, the amount of bleeding, the age of the patient, the resistance of the host, and other factors that modify the ability of the connective tissue of the injured pulp to repair itself. 4. In the lesion, the mesenchymal cells of fibroblasts go through a period of proliferative activity. Later, during the restorative phase, the differentiation of some of these cells into dentin-forming elements occurs, which are responsible for the appearance of the dentin bridge. Sometimes the pulp remains to persist with chronic inflammations and sooner or later succumbs despite the bridge. Now we are going to talk about partial biopulpectomy. Well, this is an endodontic treatment by which the affected or infected coronary pulp is removed under anesthesia. It's also called biopulpectomy. Its purpose is for the root pulp to remain healthy or to be able to heal after the affected or infected coronal pulp has been amputated. The formation of a dentin bridge can cover the root pulp. Well, its indications and contraindications. Its indications is when direct pulp retention cannot be performed because the size of the exposure doesn't allow it. When the success of direct pulp retention is in doubt. For keeping the vital remand until its formation is complete. In young permanent teeth with curious reversible pulp processes, provided that it's certain that the pulp remand is not compromised. Contraindications: adult teeth with small root canals, and old teeth with irreversible pulp pathologies. Operatory technique. After doing a correct diagnostic, we proceed to first to absolute isolation of the operative field, then caries removal if there is any, and access to the pulp chamber according to conventional techniques. Removal of the coronary pulp with a slow speed bore whose diameter is bigger than the canal. Washing the cavity with calcium water with a syringe with a curved needle. Placement of a calcium hydroxide paste on the root remained unaltered. Postoperative radiographic and remote control to verify the degree of apical development and deformation of the dentin barrier. Postoperative control. At the end, the dentin bridge can be visualized radiographically at 3 months, although in some cases it could be appreciated in a shorter of time. Prognosis. After a partial biapopectomy has been performed, two probable factors should be considered: the infection and the atypical repair. The infection is produced by a contamination during or after the operative act, which could lead to irreversible pulpitis or necrosis with infection. It is easily diagnosed because the patient has severe pain. In this circumstance, a total biopulpectomy is performed. And the atypical repair. Sometimes the repairing capacity of the pulp is unexpected and exaggerated, and forms a dentinoblastic bridge that obliterates the pulp chamber and even the root canals. An internal dentin resuscitation may also begin, which will be the most serious complication, the treatment of which will be the total biopulpectomy of the tooth. This complication may be due to the cutting of the pulp and/or excessive pressure in the placement of the calcium hydroxide dressing. Conclusions. Conservative treatments are of vital importance in cases of permanent teeth with open apices to protect the pulp remain until apical closure is achieved. Thank you.